You're tuned to Evergreen Media Network. I am Cindy Schwartz, and this is the Patient Partner Show. We're on iHeart Talk Radio, so look us up there. And we're also a podcast on Spreaker and distributed on its platforms. Jeannie Roller, you are in Indiana, and I am in Florida, and we've got another. This topic is never ending with the cost in health care, and now we're talking about why they're cutting, how we can and why we should, which I agree, cut healthcare costs. It seems to be a topic that's out there in words, but not in deeds, if you will. And I don't know, people are double dipping. We did on the podcast another one we did talking about your mom and some of your family members that were trying to be forced into having appointments more often. Services more often than they felt that they needed. Again, we're not doctors, we're not lawyers, but what's the first thing that they'll ask you in some of those medical papers is you know yourself best, so put down what your symptoms are or what it's actually going on with you. So if you're asking us that out of the get-go and then you're not even listening to us when we say it and you're saying, oh no, but you really need to have 5 appointments a year and blah 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 blah, we can go on all night long about this, all day long about some of this. So this specific podcast is going to be talking about cut healthcare costs, and Jeannie, have at it.
Well, Cindy, I think on one of our previous podcasts, we kind of covered it. They were wanting to force repetitive services. Well, if you're telling me that as an insurance company, you need to raise my rate because you're not making any money, then why are you doing repetitive services? Mm-hmm. You obviously have enough money to pay for things that really don't need to be done. The other thing that bugs me is that, insurance companies, they negotiate and sign contracts with hospital systems and doctors and so on and so forth, saying that for X number of dollars, you will see X number of our clients. But then when you make use of the services and you get the explanation of benefits paper, it comes out like they're spending millions of dollars on you to do a certain procedure, but then they negotiate it down to where you only have to pay X number of dollars, which I kind of think is probably the real cost of things. But they want to make it seem like they're providing a value service to you. And it is just so hard. And I am old enough to remember when you used to be able to call a doctor and say, I need an antibiotic because I have this and this and this. And you could get the prescription given to you over the phone. But nowadays, that doesn't happen. You have to go in and see the doctor so that the money gets paid down the line before you can get your prescription. But then the insurance companies have come out in this article I was reading saying that, well, people don't want to administer shots like for asthma themselves, that they want it done in a doctor's office. Well, maybe some people, but I'm sure an awful lot of people would rather learn how to do the self-care than have to go to the doctor and run up the cost to have it done, when if they were taught they could do it themselves because the condition is one that is stable, is not going to go away, has been diagnosed, and so on and so forth.
Yeah.
So I think that their insurance companies, in my opinion, have gotten out of hand where, they say that, well, we don't really know the cost of things. Well, I do know the cost of things when I have to pay that premium. I'm not getting all this care for nothing. I am paying a premium.
Yeah.
And then I have to pay extra when I actually get the service.
Well, that's the absurd thing about it. Maybe that's not the right word, absurd, but in my mind it is absurd because it's their specific formulary. We're not privy to that. And where is the transparency for these bills? We're not privy to that either.
Right.
We all know, and it's been a joke for a really long time, 100 years or whatever, that if you go to the drugstore or you buy a box of Band-Aid, it's, $3 for 100 Band-Aids or whatever it is. But yet if you go into the hospital and you need one and it's going to have some specific terminology for it, it's not going to be called a Band-Aid. that one Band-Aid, that one bandage, whatever you want to call it, is going to be $35. I mean, we've all laughed about that.
Right.
If you want a bottle of 100 aspirin and you go to the drugstore, it's going to be 99 cents. But if you go into the hospital, it's going to be called, blah, 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 big specific name with all of its Latin interpretives and all that. And it's going to be $75 for the pill. So we all know that that's just a joke and a half. But the other thing that bothers me about it, what you're talking about it is, again, my opinion, my words, how we're being coerced into believing that you need health care insurance to begin with. When you and I have talked about it and talked about it on other podcasts, that when you don't have insurance, and I've spent most of my life without insurance, without medical insurance, you can negotiate for cash. Any doctor will that I've been to, and I'm not going to say any doctor, that's wrong, but doctors and places will negotiate for cash and you can make payments. You used to be able to make payments. So where's the coercion? They want the guaranteed money. So now we have a guaranteed pot. You're showing us all these things, in my opinion, to scare tactic me, saying, oh my goodness, if you go to a hospital, do you realize it's going to be $75,000 just to have so-and-so? When that's not necessarily true if you have people that are going to work with you, and many doctors do, when you pay for cash or make arrangements. It always used to be like that with maternity patients. I mean, I'm not that ancient that I remember the day when you went in for your first pregnancy exam. Yes, you're pregnant. Okay, this is what it's going to be, and you made payments on it. Most people didn't have insurances. Right, it's not that long ago. Most people didn't have insurance. That's a whole other 20 podcasts if you want to get on that subject, which I really don't want to. So what's the bottom line now? Here we go. It's all about how you've now lied to us and coerced us and told us this is what you need for insurances. You have to have this. There's no getting around it. You cannot live a second longer without having this insurance. This is the premium, $600 a month, which most people can't even afford this stuff. And now you're going to have a copay and a derivative and an out-of-pocket and label it however you want it. At the end of the day, I'm paying tenfold for something that shouldn't even have been happening to begin with. My opinion. Yeah. It's my opinion.
And don't forget, if you use the services, you must get it pre-certified, and even then they may or may not pay it.
Right, exactly. It's all you're right. It's a pre-authorized right. You're exactly right. And to add insult to injury, if I decide that I think acupuncture, just throwing that out as a word, or a massage, or whatever other kind of therapeutic thing would help me better, that's not going to get paid for in a healthcare avenue, even though that's what I'm using it for. Now, I do get the point that there would be too many, and I don't get the point where there'd be too many hands in that pot. Really, at the end of the day, that's what a lot of this is about. So, we've got $17 trillion in there, but we only want 4,000 people taking advantage of that. So because you're a massage therapist or because you're an acupuncturist, that doesn't qualify as our definition of healthcare. Right? Because that's what this boils down to. What's actually the definition of healthcare? If I feel that some kind of I don't want to sound like, that I know, the medical procedures, because I don't. But if I feel that this cream or this whatever stuff is going to help me, and it does help me, then why isn't that healthcare? It is at the end of the day. It is at the end of the day. But I get it that there has to be a certain structure to all of this. I do get it. I'm looking for the transparency, and I'm looking for the actual payments or the actual fees on these things. I know that Band-Aids aren't $75 each.
Yeah.
Yeah.
And I would like to see these contract prices that they actually negotiate.
Yeah. Okay. That's right.
That's what I'd like to see.
That's another podcast that's at least a couple of months of podcasts on that one. It's just crazy. On what I mean, at the end of the day, it's just I'm sitting here shaking my head, going, I just can't even believe that we have to talk about this, because it's just mind-boggling. It just is. Give me the 100 aspirins for 99 cents and I'm good. On that note, stay listening to Evergreen Media Network.